Hi, I'm Mohammed Maher. I'm from Bangladesh. So here the COVID cases are increasing every day, and we have around 1500 cases every day. A few days back the cases were recorded way more than that, but due to the lockdown it decreased significantly. The Bangladesh government bought vaccine named AstraZeneca from India, and a lot of doses were purchased, and the Bangladesh government also received few gifts from China and also from India. The vaccination process was very easy for the individuals who wanted to take the vaccine, but before only the frontliners were allowed, and the old people over 40 years old were allowed to take the vaccine. And even now the over 40 years people and the frontliners are taking the vaccines, and we also have a shortage of vaccine right now due to a bad situation in India. As we all know, the COVID cases are increasing every day significantly. That's why Bangladesh is unable to purchase more vaccines from India. That's why we are purchasing vaccine from China. The government made it very easier for the individuals, because in online you can register for the vaccine and it's very easy and also user friendly.
Hi, my name is Raven and I'm from Malaysia.
Now, the current state of COVID in Malaysia as of 30th May is 6,999 for new cases. Out of that, the recovered cases is 5,121. The total active case is 78,017 with 79 new deaths. Vaccines that are available for Malaysians are Pfizer from USA, AstraZeneca from UK, Sinovac and CanSino Bio from China, and Sputnik from Russia. Our Prime Minister have stated that every citizen and non-citizen are eligible to be vaccinated without any necessary payment. For any individual to get vaccinated, there are several steps they have to follow through. First, any citizen and non-citizen can download My Sejahtera app, or they can travel to nearby clinic to register for their vaccine application. Through the registration, you will be given an appointment date, which the vaccine receiver have to be present at the determined vaccination administration center or VAC. Once they have reached the determined VAC, there will be a temperature and symptom assessment along with identity confirmation. There's also consultation from medical team, and an authorization form will be given and have to be filled by the vaccine receiver. Once it's completed, that individual will receive vaccine along with supervision from medical team for 30 minutes. If there are no adverse effects, the receiver will be given a vaccination card and will be placed under adverse event following immunization or A5. That individual would then receive a second appointment date for the second dose of vaccine. On that date, that individual had to be registered the same way as before. That individual would then receive the second dose of the vaccine and will be supervised by the medical team for the first 30 minutes. That vaccine receiver will be given COVID-19 vaccine immunization digital certificate at the end of vaccination process. It has to be noted that the number of doses are subject to the type of vaccine administered. Vaccine receiver could report any side effect by informing to a medical facility or through My Sejahtera app, or by NPRA Conserve site at www.npra.gov.my.
I'm Dalito from Malawi. There were 6 new COVID cases reported today, now bringing the total number of confirmed cases up to 34,335. The Oxford AstraZeneca vaccine is being distributed by the Malawi government at local centers, and anyone from Malawi can receive them so long as they have a valid ID.
My name is Abdul and I'm from Comoros Island. In this video, I will talk about the current situation in my country during the pandemic. So, in my country, there's no more than 5 cases per day since the vaccine arrived. But in the beginning of the pandemic, there were 10 and 20 per day, and increased every day until reaching 200 cases per day. But now, thanks to the vaccine, 90% of the cases were cured.
My name is Ahmed Ubaid and I'm from the Maldives. Currently, the COVID-19 situation in the Maldives is at an all-time high. According to Bloomberg, as of May 24th, 2021, Maldives has had the most COVID-19 infections per 1,000 people in the last 7 and 14 days. There are strict precautions being put in place to combat COVID-19 with a lockdown and a curfew being put in place. What this means is that people are only allowed to go out within 8 a.m. to 4 p.m. To go out during this time, you would also need a pass. Each household has 2 passes allocated to them and a different time frame allocated to each of it. This time frame is either 8 a.m. to 12 p.m. or 12 p.m. to 4 p.m. The vaccine initiative that's been provided by the Maldives is on 20th January 2021, India donated 100,000 doses of Covishield, and Maldives has also made arrangements with AstraZeneca to purchase 700,000 doses from them directly. Vaccination priority is given to frontline workers, people at high risk, and essential workers.
Although this video aims to provide details about COVID-19 vaccinations in different countries, it is purely informational and does not negate an individual's right to freedom of choice. That being said, we've all witnessed firsthand the terrible effects of COVID-19, and so here are 5 simple steps that you can take to help prevent the spread of the virus. First of all, remember to always wear your mask, especially when you're out in public spaces, and wash your hands regularly and thoroughly. Practice social distancing and keep a minimum of a 2-meter distance from those around you. If you're feeling ill or experiencing any of these above symptoms, get yourself tested for COVID-19 to protect your own health and ensure the safety of those around you. Adhere to government SOPs such as curfews and mask-wearing mandates. And finally, stay at home, because limiting your exposure to other people drastically reduces the effects of the virus. We sincerely hope this video was useful and beneficial. Thank you so much for watching.